Dr. Marini, welcome.
Thank you.
Thanks for being with us.
Yeah.
So before talking about some relevant topics of the book, I think it's worth spending a few words about its title. What can you tell us about narrative medicine being a bridge between clinical sciences and humanities sciences?
Yes, I've chosen this metaphor of a bridge because I think that it really represents the fact that we have to connect the two shores. The shore of the individual who is struggling between health and disease, and the shore on the other side of all the healthcare professionals who are dedicated to bring him back or her back to a health status. But I think also that the bridge is also a metaphor for joining together the healthcare demand now. There are huge cost cutting in the healthcare system and the needs of the whole population. And also another thing is that the bridge is a metaphor which joins the body of the patient with the soul and the mind of the patient. So the bridge is a metaphor which can be also translated into a word, narrative. Narrative is a basic trade union between the different shores on the river.
Okay. And maybe at this point it could be useful to understand the specific differences between medical humanities and narrative medicine. Could you clear this up?
Yes, there is a lot of confusion about these two words. One thing that medical humanities are narrative medicine, and it's not like this. Let's talk about medical humanities. Medical humanities are every artistic expression about medicine, about disease, illness, and about how the patient lives with disease and illness. When I'm talking about artistic expression, I'm talking about literature, theater, cinema, I'm talking about paintings and all visual arts. So one of the masterpieces which is used in the course of doctor-patient's relationship is the death of Ivan Illich. I think that it is used everywhere in all the university of the world. When we are talking about narrative medicine, we are talking about real life practice. So in this case, narrative medicine is the narrative, is what occurs between the physicians, the nurses, the whole equipe involved in the taking care of the patients and his or her family. So here we are collecting real narratives, real stories, not inspiration to real stories. So I think that this is why narrative medicine is so important, because it's not manipulated and it's genuine.
Okay. For you, as stated in the book, there is an urgent need for a change in the academic world with regard to narrative medicine. Can you give us some examples of actions that could be implemented in medical schools?
Yeah. Before giving the actions, I would like to talk about the problems, because the problem has been clearly demonstrated into different publications, and these studies showed that the students of all scientific faculties are becoming, of the third year of attendance, less and less empathic. And so social skills are quite risk to be constrained somehow. So this is a problem. And now how to counteract this problem? There might be two solutions. One solution, first solution could be to create a medical humanities, narrative medicine course already starting from the very first year of university, and the student will go on and so developing and empowering these social skills. The other solution that I think is very important, because in this way we're not just creating, a separate course, but we are really changing somehow the way of teaching, the global way of teaching of the Faculty of Medicine, is to create the cases that we teach the Faculty of Medicine or in scientific faculties, more animated. When I'm talking about more animated, I'm referring to the fact that we are not just talking about the disease, the signs, the symptoms, the body of patients, but we are talking about the context in which the patient and the person lives. So I'm referring to the fact that we want to know about a hypertensive patient, where does he live, whether he has or not his job, whether he's married or divorced. So to completely understand in a holistic point of view which are his beliefs and which is his frame of context, where does he come from. So I think that only this way we really can take care of him in a very profound way, and more efficient and more effective.
Okay, I understand. In chapter 10, you mentioned a recent study, the study of Starmer and colleagues, in which implementation of communication skills was associated with reductions in medical errors. You want to give a comment? You want to give a comment on such results?
This is a very good study. When I was looking for something which was really trying to prove somehow the economic benefit of narrative medicine, I found these studies published on New England Journal of Medicine, so it's quite important journals. And they have adopted a protocol in which in some hospitals they have applied the communication skills, communication protocols, and the students and the physicians and all the equipe had to be consistent with this protocol. And in some other control hospital, they didn't apply any type of this communication protocol, and they just left free. So at the end of the day, the outcomes are that if you apply a good communication protocol, either by written or by talking, at the end of the day, you have 23% less of medical errors and 30% less of adverse events, preventable adverse events. So here we are talking about also not only about health benefit, but we are talking also about money, which is saved somehow, because we know that medical errors prolong the length of stay in the hospital. And so I think that this was a very good study to show that narrative medicine can produce also an eco-friendly system, a sustainable system.
Okay. And as a closing remark, what would you like to say to practitioners who are still have doubt about the usefulness of medicine, narrative medicine?
Yeah, I want to reassure them saying that we are not fighting against evidence-based medicine at all, but we think that evidence-based medicine is absolutely fundamental because it was a system which was thought to bring order in the chaos of the previous ancient medicine somehow, and to bring some rules about why choosing one treatment and not the other one. The only problem is that what has been demonstrated is that in some countries, what we know is that at least 50% of the physicians do not follow evidence-based medicine protocols. So we're saying why they don't follow these protocols. Probably because they still are quite rigid somehow with the patients. They don't know how to embrace the patient in the whole holistic way. And just after you can clearly understand yourself and the patient and what the patient transfers to you, just only after this step, so the step of the real encounter, of the real alignment, then you're able to apply evidence-based medicine. Because otherwise you might risk to lose one patient out of two. So this is why this is a leverage I would ask for convincing evidence-based doctor to use better evidence-based, because so narrative medicine is a tool to use better evidence-based medicine, and this is still not clear. And now it has changed narrative medicine a lot from the very beginning. Very beginning was just few cases, sporadic cases, but now with the new technology, new software which are able to analyze hundreds of patient stories, or for not saying thousands of patient stories, we can drag out numbers in a complete different way, which are taken out from stories of the patients, which are based on the real patient's need. And so if you want to be a good carer, a good doctor, a good nurse, a good therapist, I think it's a wonderful tool to be able to go through this fascinating world of narrative medicine.
Very clear. Thank you for your time and good luck with the book. Thank you.